All right, everyone. Hi, this is Ali. I wish I was doing my first Facebook Live video under better circumstances, but here we are. I know this is a scary time, definitely unprecedented, but we wanted to do this video because we are getting a lot of calls, a lot of concerned clients and doctors from around the country asking questions about what to do about their practices, what to do about their employees. So hopefully this information will be very helpful. I'm going to give you a couple of email addresses at the end so that you can communicate with us directly, whether you're a client or not, because we know this is just kind of a scary time. So let's jump into it to begin with. So as you guys know, obviously this situation is a global epidemic. We have seen what happens when countries are slow to act, and they are still dealing with some of the situations that are happening in terms of the epidemic. Some other countries like South Korea and China are seeing a drop in new cases and deaths. So there's a plan that seems to be working. For us right now in the US, we are in the middle of it. As many of you know, the California Dental Association last night took the very serious and drastic step to recommend that all dental practices in California close their doors. As many of you know, the CDA doesn't necessarily have authority to make you close, but if they're taking this step and making this recommendations, you should take it absolutely seriously because they have your best interest in mind. As of a few minutes ago, I just got word that the Bay Area counties, San Francisco, Contra Costa, Alameda, Santa Clara, are all about to announce that only essential businesses shall remain open. They're basically telling everyone to stay home. So essential means emergency type services. So this is happening here as has happened in China and Italy. So we just have to be ready for this. A couple of things to go through. One is that there is no national closure right now. I know there's been some text messages and social media postings that seem to be fake, or I can tell you are fake. There is no national shutdown that has been passed by the White House or the administration. So you have to be very careful about what you read online. There is nothing like that yet. It doesn't mean that in the next 10 minutes or a couple days or weeks that won't happen. But as of this moment, there isn't a national shutdown. Some states are beginning to take steps to close borders. We believe they were going to start doing that. There are some that are closing businesses. All restaurants and bars, of course, are closed. So what does this mean for you as an employer? So a couple of things that you need to keep in mind. One is that if you do decide to close your office and don't see any more patients except emergencies, you do not have to pay your employees. Now, the common question is, what about my hourly employees? If your hourly employees are staying home because you decided to close your office, then you're not required to pay them. That being said, the same thing applies to salaried employees. If your salaried employees are staying home because the office is closed by your decision or otherwise, you don't have to pay them, which is good from a business perspective, not so great for them, of course. So as a result of that, many states, including California, have passed unemployment rules that waive any periods of time where you would typically have to wait before getting unemployment benefits. I have posted things. It's very easy to find online where your employees can go online and post for unemployment benefits. They should do that immediately because we're assuming that almost every employee in California will start to apply for them. Other states are following suit as well. So whatever state you're in, I'm sure you can find that information readily available. The other thing is there's some information out there regarding mortgages and bank payments. Although the administration talked about this early on, nothing has been passed waiving mortgage payments, loan payments, rent payments to your landlords. So it's vital that you keep those up for over the next month or so. If this thing extends into April and May, I think the two primary things for you to always keep in mind is that you want to make sure that your mortgage payment to the banks and your payments to your landlords are made on time so that there's no breach of your leases or breach of your mortgage documents. We do expect that if this thing kind of continues for a longer period of time, that there will be some relief, but as of right now, there is no relief available for private employers. So please keep that in mind as well. In terms of what the federal government passed this weekend, they did pass that 2 weeks of paid sick leave is now available for some employers, and also 3 months of leave if you're taking care of somebody. The rules are still being hashed out, the exact language, but what we do know is that you have to be actually infected by the virus, or your immediate family member has been infected, and so you're taking care of them. So this is not a sort of a blanket rule. Now, there's a couple of things there. This is the paid sick leave is paid by the employer. The federal government has the option, although they haven't enacted it yet, they have the option of excluding small businesses, meaning businesses less than 50 employees, because of the financial impact that this could have to you. So as of right now, employers that are more than 500, which none of you, most likely this is applicable to, don't have to provide this, but just kind of keep in mind that you may be required to provide paid sick leave or paid time off as well. Tax credits are being provided to to employers through the federal government. It's right now the limit, we believe, is about $2,000 per employee max. This is not immediate cash in your pocket, of course. This is through your tax returns or whatnot, so there will be some delay there, but your tax professional can help you with that. Thank you all, by the way, for all the questions that are coming in. Keep sending them in, and at the end, I'll go through them and answer as many as we can. Testing for the coronavirus will be free as well, and that's what the government passed, so that's great. We've gotten some questions also about insurance. If you have overhead insurance with any carriers, whether it's TDIC or others, as of right now, we don't believe that the policies cover a virus or an epidemic like this. The companies are in discussion to see what reliefs they can provide, if any. We're working with some insurance professionals to see what is available potentially under the insurance rules and the policies that you may have, but there may not be something available there. Let's get into some questions that we've gotten the last couple of days. Some of the questions are, if the states have declared a state of emergency, what does this mean for unemployment benefits and EDD? Can I, as the doctor, apply for unemployment benefits as well as my employees? So what it means when the states declare a state of emergency is that the waiting period for unemployment is waived. So both you as an employee of your corporation or PLLC, if you're outside of California, or if you're self-employed without a corporation, you may be able to file for unemployment. Your employees definitely can file for unemployment, especially if you're closing your office as the CDA is recommending. The other thing is, the other question that we usually get is, can I make my employees come to work? And as of right now, you can force some of your employees, if not all of your employees, to come to work if you are treating an emergency or something of that nature. I would be very careful about that, however, obviously, because of the situation. If there is a state lockdown or a lockdown in your county, that may change. I would definitely not require anybody who's in the more risky group, 65 and above, or maybe pregnant or some other, underlying health issues. I would not ask them to come to work. But if you have to treat a patient, if it is an emergency, you don't want to abandon your patients. You want to be able to treat them. So you can request your employees to come. The other question we get is, do I have to pay my hourly employees? So the answer to that is no. As I mentioned earlier, you don't have to pay your hourly employees if they're not working because the office is shut down. Some of our doctors are paying for this week, some are not. You have to really look at your kind of financial ability and decide whether that's something you can do. Now, if you do decide to pay them, that will impact their unemployment benefits. So kind of keep that in mind as you're contemplating whether to pay them money now or hold off until later. But whatever monies you pay will definitely impact unemployment. Some other questions that I get is, I've got employees who are 65 and above or close to 65 and they refuse to come to work. What should I do? We would say that it's time to be compassionate about that. Let them stay home. If they're in this risky group, just let them stay there and out of harm's way, and just try to figure something else out with the team members in terms of answering phones or whatnot. But I would not recommend anybody to be required to come in who's in that risky category. Paid out PTO, paid time off. Do I have to honor it? Is another question I get. If your employees have paid time off or they have vacation time and they want to use it while your office is closed, you are obligated to let them use it. Remember, paid time off and vacation is considered earned wages. They've already earned it based on your office policies, and so it's their money. And if they want to use it to offset the income they're going to lose by being outside of the office or the office being closed, then that's their decision, and you should honor that. What happens if I get the flu? If you are tested positive for the flu and you've been seeing patients during the time that you may have been infected, it's very important that you notify every one of those patients that may have been in your office that day to let them know that they may have been infected with the virus, so that they can be aware of it, they can quarantine themselves and maybe go get tested if they get a temperature or they have a hard time breathing or have a cough. It's vital that you notify them. We have gotten some information that some vendors who have visited dental practices, whether it's suppliers, distributors, or technicians, have also been in fact have been diagnosed with having had the virus, and so as a result of that, we've notified those practices to notify all those patients that had come in those days as well. So just remember, this is about managing the virus. So if you're infected or anybody else in your office has been infected, it's important to let all those patients know. Now let's go to some of the questions you guys have been asking while we've been on this live, Facebook Live. One question is, what is our liability if you keep the office open and an employee becomes infected? That is the $1 million question, and that might be the liability. It might be $1 million or more. We don't know. We don't know. If someone passes away, God forbid, as a result of the virus and you force them to be open, there likely will be some serious liability there. I think you have to play it by ear. What happens if you force employees to stay and they get infected. A lot of you have seen, I'm sure, the New York Times report from I think it was yesterday that put the top 10 list of highly dangerous jobs during this coronavirus, and the top 6 were either dental, medical kind of positions. So I think I would ask the employees who is willing to come and work, and if they're younger and they're healthier, that might be the better choice than having someone who's either immunocompromised or older in your office. Another question is, if we are closing our doors at the recommendation of the CDA, what communications should we send to our employees, including info on pay? And so I think a lot of the information that I've given you today is information you can use for your employees and for your patients. I think everyone understands the scenario right now, and so this shouldn't come as a surprise for most people. Feel free to email us though at the end of today if you have specific questions in terms of letters. We have drafted some letters that we are sending out for some of our clients, so if anybody needs those letters because they've got a documented case of the virus or they're closing the office, let us know and we'll happy to give you a draft. Our employees might want to work somewhere else while we are closed. If they are collecting unemployment, can they still work at another job, is a question we got. They can certainly work at another job, but they probably will not get their unemployment benefits as a result. And so if we're at a situation where the offices and the businesses are being closed, the likelihood of them being able to find another position is probably slight. But if they can certainly find another job, however, that will impact their unemployment benefits. What forms need to be filled out by the employees if they collect unemployment? Everything is run through the states with regard to unemployment, and so they will go online or fill out paperwork and mail it in, depending on the state. The state will send you some documents for you to fill out regarding their wages, and then payments will start after that. You know, depending on the state, it varies, but it could be anywhere from 30 to 65% of the monies that they've earned with you are what they're going to get in terms of benefits. Some of these last 12 to 15 weeks. In certain situations, they can last even a little bit longer. Can we allow employees to go negative in vacation vacation time and take it as they accrue? The answer to that is absolutely. You can allow employees to quote unquote borrow vacation time or PTO, and then you allow them to kind of earn that back when the office is open again. That is completely allowable. You have to remember though that there's no guarantee that they will come back and work for you, or that you will be given the opportunity to get that vacation time back. So it's a risk that you take, of course. But assuming that we're all back in a couple weeks to a month or more, and business is as normal, then they should be able to get that back as well. What happens if we don't pay the employees and we close? So if you don't pay them for the amount that they've worked thus far, you will have personal liability. California and many other states have a dual employer rule, which basically means that your corporation and you personally as the owner are liable for wages. And so if you don't pay for the amount that they've worked to date, then you'll have that liability. If you don't pay them moving forward because the office is closed, that's allowed because obviously the office is closed. So that's not an issue. How does this apply to new business owners? If I just acquired my practice on March 2nd. Nothing really changes, unfortunately, for you. I know we do a lot of transitions nationwide, and I totally understand the stress that it comes with buying a new business and now having to close. What I would say is that if you've got a new mortgage with one of the dental lenders, to give them a call. Every lender that we've spoken to so far has been open to the idea of doing something for their customers. They couldn't really speak on record because the situation's ever evolving very quickly. But we've had a lot of banks really step up during disasters, including Live Oak Bank, who really stepped up during the Paradise fires and the Sonoma fires and some other emergencies. And so I would recommend that you contact the banks and see what they're able to do for you, if anything. What if an employee is working part-time? Can they apply for unemployment benefits? Anybody can apply for unemployment benefits. So please remember that their unemployment is based on the number of hours that they were supposed to work and the monies that they were supposed to earn with you, and what that was cut short. So if they were 50% less, they will get some percentage of that. What happens to medical benefits? I'm glad someone asked that question. I got this question over the weekend. Can I stop making medical payments? I highly discourage anyone from stopping to make medical payments for their employees. This is a very real situation that is impacting the entire population. There will be some relief, hopefully, to help you, but stopping medical payments at this point, especially with what may happen if somebody has to go to the ER and get emergency services or otherwise, would be really, really terrible. You may have a personal liability over that. Definitely may be responsible for their medical bills if you cut their insurance in the middle of this. More importantly, if you were supposed to give medical insurance to your employees and you did not, then you may be on the hook for their medical bills if they get sick. I would encourage you to have those employees who may not have insurance and should have had insurance and whatnot to try to apply right now before anything happens. It may be too late, but it's worth a try. Regarding PTO, can employees on a probationary period get PTO? So it depends on your office policies. If you are an HR for Health customer or a client of our law firm, our employment manuals say that PTO is typically earned after, they pass their introductory period or the probationary period. Some states with sick leave law, like California, go back to the date that they were hired. So it all depends on your employment manual, but you should contact one of us and we can help you walk through that specific scenario. What do you recommend for employees that have worked for us for less than 3 months and the hygienists? So I'm not sure anything changes there, whether, regardless of how often they've worked for you. I think, your decision to pay or not pay should be made on a global scale. So try not to discriminate against one group or another. Obviously, with what CDA is recommending, and also the governor here in California and other states, and also now what's happening locally, I think what's important to keep in mind is that, if you're closing the office, it's impacting everyone. Treat everyone the same. You may run into issues if you start paying one group of people and not another. What if I was planning to terminate an employee this Thursday due to schedule changes? We are right now recommending that no one terminate any employee, whether it was for performance reasons or otherwise. The timing is just really terrible. The laws that are being passed right now by the federal government and also are being discussed here locally in the states, but in California specifically, protect jobs. And so the thing you don't want to do is you don't want to be in the mix of that where you just terminated somebody and are violating the rules. So I would be very careful about this right now. It's a touchy time. Obviously, if you're closing the office, that's not an issue, but terminating somebody for this may be a problem. Can employees use sick leave if they have used their PTO or sick leave just for the actual illness? Yes, they can use their sick leave really for anything right now. Got another question. If an associate is on call from home and doesn't have to come into the office, are they entitled to pay for just being available? When you say an associate, if it's a doctor associate who's on call and they're not doing any work, they're just kind of waiting, then probably not, depending on some other facts, but probably not. If they're doing actual work or taking emergency calls or anything of that nature, then they need to be paid for that, most likely. This includes if any of your employees, if you have people doing telemedicine, if you will, from home, and they're answering phones and whatnot for you, then those need to definitely be paid. Do I need to, let me see. If my office manual states all earned PTO, including sick leave, must be utilized prior to time off, non-paid, can we force them to take their PTO and have them file for unemployment afterwards? Yes, you can, especially if your manual says that. Most employees will probably use their PTO because it's their full wage or whatnot. You can require them to use that up and then go on unemployment if your manual does say that. I do recommend that you become a little bit more flexible on some things. But if an employee really doesn't want to do that, I would sit down and sort of have a discussion with them about it. But if you really want to force them to, then you can. What is a website where people can get unemployment forms? It's on our social media. It's the EDD website here in California, the state unemployment websites in other states. If you have any questions about that, you can email us, or if you can't find it, we'll email it to you. But if you just Google EDD and coronavirus, that will come up as well. Can employees get paid time off while collecting unemployment? No. Paid time off is really if they're working and earning wages for hours in the office is where PTO really kind of comes into play, not while they're on unemployment. I practice optometry in California where shelter in place is expected for all non-essential business. Do we qualify as an essential business? So the shelter in place that you're referring to applies right now to, it's about to be announced, I think in a few minutes, to all counties in the Bay Area. And so although there hasn't been a lot of information about it, we don't believe that veterinary medicine, opto, or dental really apply for that unless there's an emergency situation with a patient or an animal. Then I think that's a different scenario. But normal exams, whether it's eye exams or hygiene exams or general well checks for pets, I don't think those would be considered essential businesses. But we'll know more when they actually issue the order. We think by 1 o'clock today. Let me see. I think we've answered a lot of the questions. Can we notify employees if we decide to close the office? Absolutely. Most offices that we've talked to in the last 48 hours are closed either half day today or all day today, but definitely starting tomorrow, there's very few people that we know that are remaining open. I will tell you, there has been, rightly or wrongly, and I'm not one to judge, but there have been a lot of social media backlash over folks who have decided to remain open. So just kind of keep that in mind because it may cause a situation where you're not looking to be the center of attention in your community if you decide to remain open despite a lot of this news that's coming out. So although the CDA is only a recommendation, it's a strong recommendation, and I think everyone needs to take it very seriously. This also is going to start happening in other states as they take CDA's example and follow suit. So just kind of remember that. Let's see. One staff member has been diagnosed as positive. Do we have to close the office? So again, you definitely have to notify all patients that were in the vicinity of that employee over the past few days or whenever they think they got infected. I would notify all of them via letter and otherwise, and then I would close the office and do a full scrub down or whatnot, and make sure that from a OSHA perspective, you're clean. There's a lot of protocols in place right now for dental and medical practices from OSHA, so I would look at that as well. Most of you are already doing very well because you have all these requirements already in place. But remember, this coronavirus is very different than a lot of other things you've dealt with in practice, whether it's hepatitis or HIV or other things. And so this is a whole different beast. Same family in terms of the virus, and you're better protected than most. But because this spreads so easily through aerosol, and because you're in people's mouths, and because of the situation that you're in when you're treating these patients, this is a very real scenario, and you're putting yourself and your employees potentially at risk. So let me share an email with you. If you guys have any other questions, we are making ourselves available. So here's 2 email addresses. One is for HR for Health, compliance@hrforhealth.com. Our team is working from home starting tomorrow, but they are making themselves available to you because we know what this is. This is my email, my personal email at work, so feel free to email me as well. If you have any questions, I know a lot of you have called and texted, and I'm sorry if it's taking me a little bit to get back to all of you, but we're trying to get back to everyone. But email me and I'll make sure to respond to you as soon as I can. But use these if you have any questions. I know this is going to bring up a lot of stuff. This is a ever-changing situation. Minute by minute, this is changing. I know we're going to overcome it, but we have to take these steps to protect yourselves, protect your employees, and protect your patients. Thank you guys very much for attending this. Feel free to communicate with us. Stay safe. Thanks.